Hi, my name is Britney Kitamata-Wong. I am a PROSE provider at the UC San Francisco Medical Center. I've always had an interest in specialty contact lenses ever since I was an optometry student. I used to work in contact lens research prior to optometry school, and so that really got me interested in the science and the art of contact lens fitting. When I see patients in my clinic, I see how they can dramatically improve their vision, their comfort, and it's such a rewarding experience as a provider to work with these patients. I completed a residency in cornea and contact lenses at the Southern California College of Optometry at Marshall B. Ketchum University. And in that clinic, I learned a lot about scleral lenses, gas-permeable contact lenses, all sorts of specialty lenses. It was a great experience, and I loved having that variety in my clinical practice. Before becoming a PROSE provider, there was a limitation of what I could achieve with traditional scleral lenses. There were times where I had to look at a fit and there was something that I didn't quite like about it, but I would have to just leave it because there was no other option for that patient. Now that I know how to fit the PROSE device, I feel like it's made me a much more picky fitter because I know I can fix things that I wasn't able to fix before. Being able to offer that level of customization really inspired me to become a PROSE provider. So when I learned to become a PROSE provider, it really changed my perspective on how to fit contact lenses in general. We focus a lot on shape, on vision, on design. What we don't always focus on is the ocular health of the patient. These PROSE or prosthetic devices are really meant to help treat the eye and to improve the ocular health over time. And that's something that I really want to bring now to my specialty contact lens fitting in general. When I have a patient referred to me for a PROSE fitting, oftentimes they were trying previous scleral lenses. They didn't have great success with the vision or the comfort or optimizing their eye health. And so when I see these patients, a lot of times they've had some treatment failure in a previous lens design. The way that I describe these lenses to my patients is a PROSE lens is so customizable, it's almost like the Ferrari of lenses or devices. You can make it as customizable as you like. Versus a regular scleral lens does work really well for a lot of patients, but doesn't sometimes have those bells and whistles that we need for more complex eyes. If I have a patient where I look at them, I put a sample scleral lens on, and they really aren't getting the right fit, the shape, and I know it's going to be a tough journey down the road, I will upgrade them to a prosthetic device right away. Becoming a PROSE provider has really pushed my limits as a clinician and a fitter in general. I see now a lot more complicated patients than I was ever seeing before, and it's really challenged me to think about these patients and to really think of what's going to maximize their ocular health, what's going to make them the most comfortable, how am I going to give them the most healthy eye possible. And this is an experience that has been so rewarding for me, and I hope to continue to develop my skills in this in the future. In my clinic, I see a lot of patients who are very unfortunate. They had a lot of previous diseases and really haven't had the ability to see for a really long time. I had a patient who only had one eye, and he was walking or ambulating with a wheelchair because he didn't have the confidence to walk without sight. His only goal was to be able to watch TV, to be able to look at the clock, to see the time. And those basic things we take for granted as people with regular sight. And with fitting him with a prosthetic device, he was able to finally see the TV, he was able to stand up and walk with confidence. And I think that's a really great example of how these lenses can really help these patients. It's not uncommon for a patient to come in for the first time getting their device and crying in my exam room. I mean, they put their device on, they can suddenly see things they were never able to appreciate before. They look down at their clothes, they see colors. They look down at their hands, they see hairs on their hands. And these are things that we don't really realize are important to people, and we kind of don't realize how much of an impact it makes when we can provide them with that better vision. I think it's really easy for any optometrist who's interested to get started in scleral lenses. There are so many resources. There are training seminars, workshops you can go to really get your feet wet in this fitting process. I think the hardest part is really just getting started. It's a really big hurdle that people think is difficult to start. But once you go through a training session, once you put on a scleral lens from a fitting set, you'll see how easy it is to get started from that point on. Every company has great fitting consultants, have great fitting guides you can use, and also the consultants work with these lenses every single day, and they're going to be very helpful in guiding you through the fitting process. I think specialty contact lenses can play a pivotal role in any optometry practice. You don't have to be a specialty contact lens fitter to offer these options to your patients. We have patients all the time who desire better vision, more stable vision, better comfort. They have dry eyes. And really, they don't know that this is an option for them. It is our responsibility as providers to let them know that this even exists, and it's a very helpful tool that you can use in your practice.